Content in this video should not be construed as medical advice. It is for information purposes only. Please consult your physician with any health concerns or questions.
Hi, I'm Dr. Nichols with the Women's Clinic. The month of February is American Heart Month, and it's the awareness month for cardiovascular disease, and February 3rd is Wear Red Day to support cardiovascular awareness. Heart disease, or more specifically cardiovascular disease, is a narrowing of the arteries, and it can happen anywhere in the body, but what we more specifically think of are the coronary arteries, or the arteries that are around the heart. When they narrow and harden, it can progress to problems like heart attack. And when it happens in other parts of the body, it can progress to problems like stroke or peripheral vascular disease. We typically think of cardiovascular disease as a men's disease, but that's actually not true. Cardiovascular disease is the #1 killer of both men and women in the United States and most developed countries around the world. The typical symptoms of cardiovascular disease are chest pain, shortness of breath, fatigue, and women can have other symptoms, and men can as well. But women may have atypical symptoms. They may have arm pain or pain in their neck or jaw. They may have shoulder pain. They may also have symptoms of heartburn or acid reflux and may attribute their discomfort to a gastrointestinal problem. So any of those symptoms may be cause for concern. There are many risk factors for heart disease, and some are modifiable and some are non-modifiable, meaning that we can do something proactively about some of the risk factors, and some we can't do anything about. Number one is gender. You're either a male or a female. Can't really do much about that, and men are at a higher risk than women. Also age. As the older you get, the more at risk you are for heart disease. And then family history. You can't really beat your genes. They are what they are. So those are the things that we can't modify, but there's a whole list of things that we can modify. Modifiable risk factors include smoking, control of hypertension, control of diabetes, our weight, physical inactivity, stress level, cholesterol profile. Those are all things that we may not be able to change necessarily, but certainly we can improve most of those parameters. Well, the great thing about heart disease is that you actually can take steps to prevent heart disease. The first thing that you can do is, if you are not an exerciser, you can start an exercise program, and that doesn't mean you have to join a gym or lift weights or jog or anything like that. 30 minutes of walking 3 times a week will improve your health in so many ways, not just a prevention of heart disease. Also, maintaining a healthy weight is so important. Eating a healthy diet, low in fat, high in vegetables, fruit, fiber, whole grains, that definitely can decrease your risk of developing cardiovascular disease. Also, if you have high blood pressure, if you have diabetes, or if you have high cholesterol, having tight control on those problems can definitely decrease your risk. Your blood pressure should be less than 120/80. Your diabetes should be well controlled, and your cholesterol profile should also be checked frequently. And if diet and exercise are not enough to control that, then there are medications that can help lower cholesterol. If you are a smoker, one of the most important things that you can do for your health, for many reasons, is to stop. And there are lots of programs out there geared to help people stop smoking. There's support groups, there's medications. Just ask your doctor. They know what to do to help you stop smoking. And also, manage your stress level, because stress has been shown to be a factor in causing heart disease. So manage the stress in your life as well. Well, menopause does 2 things to affect heart disease. The first is you're older when you go through menopause, so age is not really anything that we can modify, but your estrogen levels decrease at menopause, and that has been shown to contribute to heart disease. There are so many problems right now as far as hormone replacement therapy goes. So in the past, it was recommended to start hormone replacement therapy to decrease your incidence of heart disease, but we've actually found that that's probably not true, and we actually do not recommend hormone therapy to prevent cardiovascular events. Because heart disease is so prevalent in our society and so common in both men and women, you should definitely talk to your doctor about potential risk factors that you have and things that you can do to prevent heart disease. When you go to your doctor, you should know what your blood pressure is, and you should discuss that with them if it's not less than 120/80. You should definitely discuss your weight. You should discuss any exercise programs that you might want to start. You should talk to them about not smoking. You should tell your doctor if you have a family history of cardiovascular disease, and you should also get lab work done, your cholesterol panel and such as that, to have your risk assessed more accurately.
Thank you, Dr. Nichols. Heart disease is the #1 cause of death in American women, and symptoms should not be overlooked. If you would like to discuss this or any concerns, please contact your physician at the Women's Clinic at 601-354-0869.